I was at a meeting once, and this mother told me that for dinner they had to have cup of soup. And I started talking about all the salt in cup of soup, and, doing my spiel. And she said to me, that is all I can afford. So what do you do? I can say it, but it's not relative to her life. So we start then thinking of other things. Well, have you tried cooking whole beans? As a Latina, we live off of beans and rice. So go back and support the natural. Our kids won't eat it. Well, then we get into the cultural piece. And a promotor who knows all these things can be the biggest support system to changing and understanding those things. But it's educating and having a well-informed, well-educated home. That's where the encouraging participation. So promotores intersect community and the healthcare system. Up to now, promotores have been mostly in the outreach and prevention piece. But just think if we were in the healthcare systems, clinics, hospitals. My dream is that Kaiser will have promotores in the system. That as soon as I walk out of my provider and he says, Maria, you have whatever and you're not doing whatever, that as soon as I walk out, then Ray says, okay, the promotora, she says, okay, what are you doing? What can we do together? And she goes with me to my house and she says, well, you have the stressor of your husband, your children, you're going to games, how can we do this within your environment? And then she helps me with the store. Well, let's plan how to read labels. Oh, my kids won't eat that. Let's figure out what else we're going to do. The store's not nearby. She works with me. Imagine that. Instead of saying, eat well, eat 3 servings of broccoli, and you'll be in spinach. And then they go home and they go, I have no clue what that means. That is probably here critical. How do we integrate promotoras, take us out of education and prevention, and really to change? Think of your mother. What would help your mother? My mother was given diabetes pill, and she said she had to go eat better. So she went to the senior service center. And there's a Spanish word called cochinada, which is like, ooh, it's kind of like that. Oh. And the food she got was that to her because it was a peripheral credit. And she tried going through the established systems. It didn't work for her. And then she went to some other senior service to do afternoon play or something. And my mother was a volunteer foster parent until 2 months before she died. That didn't work for her. So she found this volunteer thing that related to her. It kept her busy, kept her walking. She ate some food there. It is how do you find these systems or help us, community, develop these systems. Don't develop it for us. Let us develop or help you develop them. And these arrows are now, health reform with our movement should be moving more in this direction. So we should be helping you. You should act, we need to develop a cooperative relationship where we're helping you to help us. It's a win-win for all of us. I don't want to be unhealthy. I don't want my mother, I did not want her to unhealthy, nor do I want any of your parents unhealthy. This is an example of a program that we did, Healthy Hearts, Healthy Families. We developed it as a cardiovascular stroke program, and it is behavioral change. It's interesting that we didn't talk anything about meds, but it is teaching expert promotoras about nutrition, exercise, and really how discussing it, training 25 to train 25. We reached thousands and thousands and thousands, and we'll pass out a little summary that I did of it. And we did see change. We saw a lot of change, and this is just over really 9 months. Imagine if we continue to do this and had this support system across communities. These are they were doing exercise classes and going with each other to the market and looking at the boxes, the labels on the boxes, thinking of what alternative foods can you eat.
Maria, before you change slides, would you please read it out for those who can't read it?
We say compromiso, train promotores to implement healthy families, healthy hearts. Over 11,000 Latina women and their families at high risk for chronic disease, diabetes, heart disease, stroke, high blood pressure, overweight, obesity, and depression were reached in San Mateo, Alameda, Contra Costa, Santa Clara, and San Francisco counties. It was a Bay Area focus. We are replicating this year in Los Angeles County, that one county alone. So 12 promotoras provided 368 classes, reaching 11,306 Latinos and Latinas. Their BMI was tracked for 195 participants, which were the adults that responded. And so what we saw was a decrease of overweight from 72% to 58, a decrease of obesity from 25 to 18, an increase of normal from 27 to 40, and in total, those 11,000 reached over 58,000 with messages. So we didn't track the second phase of it, which was the second phase of the 25 of those 58. But if we could have imagined what, this shows the power of training 25. They were trained by nurses, by docs. They were well informed, they were well educated. They had a coordinator who was well informed and educated. And we fought 25, we trained 25, we trained 25. It just, we were astounded ourselves at the success, because those 25 cared about those 25. It's kind of that simple. And so they would go with them, and they developed, they formed exercise groups in garages, in parks. You'll see them in parks, you'll see them in community centers. You'll see them talking about food together. You'll see them in developing support systems. You'll see them talking about their children. It's kind of amazing. It is no different than your girlfriend and your boyfriend, your pal friend. When you talk, I imagine men do the same thing when you talk about these things. So that's what you have there as a sample.
Just, you may not have the data, but I'm just wondering if you will know what percent weight loss they are. These are in percents going from overweight and obese.
No, there's wait. Well, it's overweight from 70 to 58.
Yeah, I just mentioned because these numbers look startlingly
They are.
high, and compared to a couple of evidence-based things, look maybe better. In which case, you've got a really very valid program that many people will want to pick up. So maybe later we'll talk about how.
Well, I share this because we were surprised ourselves.
Yeah.
And what I think worked in it is that we had expert promotores who knew how to do the work. It's not, like I said, not everybody can do it, but who had been promotores for a long time. They already knew how to do outreach and education. They knew core elements of the high blood pressure, diabetes. They'd been involved in something. But we did a lot of training with the core who were going to go out so that they understood what all this meant. They could answer questions. They knew their responsibility. They worked many hours more than they were paid because there was a lot of data collection. We didn't have anything that was automated, so there was a lot of pieces of paper, which is ridiculous. So there was a lot of data, and it worked because these 12 were committed to it, and they did follow up, and they made sure, and then the 25 they recruited, they did the same thing, and they made sure. So the model was replicated at least through 2 levels. I don't know about the 58 because that would be like 3rd and 4th level, but given support and funding for that, I think we'd see, imagine what those could be. We're doing it, we stopped it, but we're doing it now, replicating this. I think this model for us is really intensifying the support, the community support. That's to me what it shows. But there are some tensions with the Promotor community health model, and I wanted to mention them. There is a community health member healthcare system versus a team member. So where does the Promotor fit? Are they a member within a health home? Very popular term. A health team. We did try with Kaiser in Fontana. We tried Promotor to be part of the diabetes management team, and they had them doing data collection, bringing in patients who hadn't responded within a year. Very successful, but that's as far as they went. They were part of that really discussion team piece, which I think is the next phase they have to go to. Are they lay people or are they professional or credential? Who are promotores? That's where the certification discussion comes in. And Visión y Compromiso is working towards, we've establishing a Promotor Institute where we will have a community certification program that will certify agencies in California who will then train promotores. Right now, you have many promotores in San Diego County, but there is no common curriculum. There is no common evaluation. There's no, across California there is none. Across the United States there is none. So as an organization of promotores, we want to see, they want to see these issues resolved because there's pride in the work that they do. And they want to ensure that there are at least minimum qualities and standards. Is it on-the-job training or is it a tailored training, standardized, specific training? That goes back to the credentialing piece. Are the roles, by that one it means are the roles, can a promotor go do whatever they want? No. Can they go do whatever they need to? Yes. Who defines that? Or are they very specific tailored roles where the job description is limited and very focused? In which case then, can the promoter really do what it is that they need to do? Are they independent and integrated, or are they interdependent? All these things are how you design the promoter model within that program. Is it reimbursable or out of pocket? That goes to the funding piece. In the past, promotores have been soft money, and there's a big discussion about the reimbursement, the certification, who's going to do it. Nobody really knows. We're part of the health exchange discussion and have presented to them in terms of navigators and assisters. So as an organization, we're very active in that. We were just funded for a policy director position. We're the only promotor association nationally that now has a policy director. So we're very vested in how we define these to better serve our community, but to better form relationships with the provider community also. And are they volunteer paid? There's a group, we have a lot of coalitions also. There's a coalition out of Santa Barbara that we work with, and one group in particular was have promotores doing the program management piece. I mean, they would do it was a food bank. They would have 3 days of food bank services, and they called in these volunteer promotores who willingly were doing it. They were doing the program. There was no staff there. They were doing it. And all they were giving them was a $20 gift card. So I stepped in and I said, that's really staff work. And if you want them to work, then you pay them pay them, give them a salary. That's that same study that we did a few years ago showed the promotores were being, if they were given a stipend, if they were given money, it was $8 to $9 an hour. We now have established $12 to $15 an hour. And some agencies quibble over that, and I say, would you do the job that they do for $8 an hour? I mean, you should try to do the work of a promotor. It is exhausting. It takes time, it takes a lot of prep, it takes being on all the time, it takes knowing who your community is, who's going to spend 10 hours at a community fair in the hot sun, talking to thousands of people, and being nice all the time. Not me. Think about the work that promotores do. Think about having to interact with people that you don't know. If I interact with Jerry, I have to be genuine all the time. It's a skill to do that. We know that. What our doctors are and our nurses. It's not just a job. It is a skill to be able to communicate those things. So whether they're volunteer paid, we're shifting that to say they really are in the professional category. So what do we do to support all this? The Institute is developing standards and core competencies associated with uniform curriculum and training. The Institute will certify and implement existing and new strategies to deliver training, support promotores, and provide technical assistance to agencies and communities, which is what we do right now. We create a mechanism to convert the promotora's life experience. So hopefully, there are there's parallel paths right now for promotores. The expert promotora who can do almost anything, who's had training, who's a trainer, there are so many skilled promotores. Even some physicians from other countries are promotores, but they don't speak English. I don't ask about documentation, but they don't. They're limited in their English version of what they can do. Doesn't matter. They're expert promotores. And then there's those that are certified by community college, which you have here in San Diego. But the path for a promotor to jump into a community college is not a natural path. It's not an easy path. I think about my mother. Could my mother have gone to a community college? No, she doesn't speak English. She had an ID towards the end. She was like 70 or something. But could she have? No. She didn't really like to drive outside her neighborhood, so she couldn't have driven to a community college. And the classes are in English, so could she have taken it? Probably. So the person who goes to a community college Community Health Worker Certificate Program is probably not this person. Remember the corazon? It's probably not that person, because the promotores from San Carlos probably can't get to downtown. The promotores from all over, and they're not likely to do it. So who is it that we're training in this? So the Institute will develop a system where we can certify, and then there'll be like a virtual training system. So that when you, as agencies, as hospitals and clinics, start looking at engaging promotores as part of your prevention and your adherence and your actual, in the system, you know that there are minimum qualifications that have been met statewide. That's our job. Because we as promotores are embarrassed when somebody is hired and they don't know how to do the job. We also have a lot of pride in the work that we do, and we want to ensure that you get the best person possible. So this here is really important. If anybody wants to support us in that, we're happy to talk to you.
Where's your training institute? Is it?
It's a virtual. So right now, the network is started that way. The network brings together promotores from all over a region, so the San Diego region. And whatever agency they're affiliated with, they come together monthly and they do a community assessment on the needs. And then they have an annual work plan on workshops that are what they think are important for personal, professional development. So that's the virtual piece of it, because it's all over. And then in addition, we put on trainings on different topic areas, like this heart or folic acid, or different topics that we take. So we go to the community. They do not come to our offices. Our offices are in Los Angeles and the Bay Area, but we're all over. We go up to Arcata once a month. We meet with our regions monthly. So there's a lot of capacity building that's involved. There's a lot of attention to the importance of who they are. We have an annual conference in December. We host 1,000 promotores. It's huge. I invite all of you to come to it because it's a great place to see the world. Everything's in Spanish. We do have simultaneous translation. Last year we had the privilege of hosting the Surgeon General at our conference. I was happy as pie to have her there. And I'll tell you the story that she came and she walked in the door, and she flew in at 12 and she was speaking at 1 and she was all flustered. And she walked in and you can see she's speaking to a Spanish audience, right? So she got on stage, we talked a little bit, she got on stage and she did her spiel in English. And she had said that she was a Zumba dancer. Well, we're bailoterapia Zumba. That's part of everything we do and everything. And there was a mariachi band on stage. She said, do you want to? Sure, let's do it. So she started to Zumba to a mariachi band for 20 minutes in full uniform with her things on.
So great.
Got sweaty, funky, had a great time. The audience, but when she did her thing, it was okay, Surgeon General. But when she started dancing, everybody stood up and was dancing with her. So I was on stage with her. I looked out with her, and there were 1,000 promotores dancing with her. And all you could see was smiles, and it was all this love that she got. There was no language other than the language of this right here. I'm telling you, it was this. She got it. She got all that love. I mean, it sounds kind of weird, but she really got all that love, and she left thoroughly understanding and convicted in the importance of community. So much so that I saw her like 3 weeks later at a White House event, and she talked about the joyous event with Promotoras. And she now is a big supporter, not necessarily of us, but the movement across the United States. And the impact that it had, because it had such an impact on her for those 20 minutes that she was dancing. To my dad, and we have a video. She approved the video. I wouldn't do it without it. And we have pictures of her, and she approved the pictures. I mean, I wouldn't do it without her approval. But it just shows you the power of just being around men and women who just seeps out. So I encourage you to come to the conference and see what it's about.
What's the date?
It's December 7th and 8th. It's in Marriott LAX. We're thinking we may not stay there next year because we could have more than 1,000. I mean, imagine 2,000 promotores together. And we have 2 days. It's 40 workshops. It's coordinated and planned by a promotor advisory committee. They do the call for workshops, which is kind of funny, but they do the call, they review, they do the planning, they do the themes, they do it's their thing. And it shows you the power of promotores. So let me see, what do we need from you? What do promotores need? Get to know the promotores in your county. Get to know the promotores in the state. There are promotores throughout the state. Arcata has a huge number of powerful promotores. Coachella, Butte County, San Francisco, we're all over. Did you have a question? Yeah, 5 minutes. So who are they? Get to know who they are. What role do they play? Promotores are not just in health. Promotores are in mental health, in schools, in financial literacy. The promotor model is now being used, it really integrated into every topic areas you can think of. Which communities do they represent? That's important because the community of San Marcos is very different from the community near Imperial. And Chula Vista, just in San Diego, Chula Vista is very different from downtown. But also you have communities of Mixtecos, and communities of Mexicans, and communities of Central Americans. We're all very different. And get to know who we are, get to know, and maybe even not know just the political level, the politics of promotores, but get to know promotores, go to the events, get to know the actual workers. Sometimes you'll get to know more about them that way. What agencies are they affiliated with? What are their workforce concerns? You know, there's a lot of development of promotor programs, and they do data collection. Well, that's fine and dandy, but then call them something else. Maybe they're not a promotor, maybe they're more something else. There's so much in that scope of practice for a promotor. It's understanding that so that they're not frustrated, you're not frustrated, you don't hire them for something that they don't want to do, they're not doing well. You know, you don't want to work in something that you don't like. It's the same thing for a promotor. There are some who can do the data and want to do it. I don't. But there are some who do and will flourish and you'll love it. But there are some who just want to be out there in the community. Understand the community, their priorities, their local assets, their solutions. Promotores can figure out what the solutions are and how your office, your agency can become more involved in that. This is the state. I was going to try and expand that, but I don't know how to do it. I tried, it didn't work. But imagine, look at how big the state is. Here's one little piece here. That promotores everywhere here. We're up here now. And they come together in this conference that you should come to. So this is what Visión y Compromiso does. We build linkages, workforce career development. The network is a huge piece. The conference, research and evaluation, we're working with USC and with other universities to do more evaluation. The advocacy policy, we just hired our policy director, so we're involved in Sacramento, and I'm involved nationally with a lot of sitting at the table discussing what the work is. We have a consulting group, it's called the Visión y Compromiso Group, where we now provide technical assistance on implementing promoter programs. And then this is my contact information. This started, toward a dignified and healthy life is hacia una vida digna y sana. And that is important because as an immigrant, you come here and you know what to do. You've done it in your home country. You've worked, you've worked to better your community, you know what the systems are, you keep the neighborhoods clean, you're healthy, you walk, you know what to do. My mother's from northern Mexico. She comes to the United States and it's a system that requires her to do something that she doesn't know. But the dignified piece is very important because we come here and we don't want to be bludgeoned over the head about how stupid we are because we don't know how to work in a system that's not familiar to us. And sometimes that's how it's communicated. You know, are they too dumb to know how to take a pill? You know, are they too? Is there what are the barriers? And if we keep pounding it into our community in a negative way, then they just retreat, and there's nothing, there's no relationship there. So the dignified piece is promotores say we come here and we want to not only live in a dignified way, which means we want jobs, we want schools, we want to educate our children. We as immigrants or native born want the same thing that everybody wants. I want the best future for my children. I want a healthy, as I age, I want to age healthy. And I want a healthy and prosperous life for my family, as we all do. So the dignified is very important. because nobody wants to be talked down to. And a healthy life means all of our life, not just our we talk about life from preconception to death. And how do we form these relationships so that promotoras can really help us from preconception to death? How do we engage promotoras in the dying process so that we die with dignity? How do we engage in the preconception so we have healthy babies, or hopefully babies later than sooner? And much of this has to do with how we perceive our community. And I'm going to say the R word, but part of it is that new immigrants come here into a system that is not prepared for them. And the elitism and racism that exists in our system is not prepared to move to engage our communities. I think the theoretical discussion is, I just lost it, but the theoretical discussion is that it's the systems that aren't in place. Well, that's true, but I grew up, as I said, in a segregated America. Well, we still have segregation. It does exist, whether it's by location or by access or by lack of jobs. You just have to go to downtown and then go to Chula Vista. You see the segregation. I live in El Cerrito, which is a little town near Berkeley, and Richmond is right below us, and Oakland. And then you just have to go over the hill to Danville and to Lafayette. Danville High School. My son played baseball, so we had to go play over there. Danville has 2 Olympic-sized pools in its high school. Richmond doesn't even have a baseball field. We're all public schools. So segregation and all these things that we don't talk about exist. And I only bring it up because this is the piece that we don't want as promotoras. And promotoras will do everything in their power, everything in our power to help our children be better. And I think we're ready and prepared to do that. Engage us, educate us, teach us, bring us in as partners, not as less than partners. That's the dignified piece, because we're experts in this. We're experts in community. And I offer Visión y Compromiso to help you with that. We have a lot of experience. We have a lot of resources. And thank you very much for letting me speak.
Thank you.